Good day, everyone online, and welcome to our Collaborative Center for Climate Health and Sustainable Care seminar series. My name is Ashley Aimone. I'm an assistant professor in the Dalla School of Public Health and a fourth-generation settler Canadian, born and raised in Toronto, which I now know as Takaronto. I'm also one of the co-facilitators for a planetary health course that's been jointly offered by the Schools of Public Health here at the University of Toronto, as well as Moi University in Kenya since around 2017. So I just want to acknowledge that joining our audience today are also the learners and partner facilitators from this course, representing both continents. So welcome, everyone. Admit more people. So as a brief introduction to the Collaborative Center for those who might be joining us for the first time, it was launched in November 2023. It is an initiative of 4 faculties: the Dalla School of Public Health, the Temerty Faculty of Medicine, the Lawrence Bloomberg Faculty of Nursing, and the Leslie Dan Faculty of Pharmacy. The Collaborative Center's purpose is to catalyze climate and sustainability action for health and health systems through research, education, and practice and policy change. And before we proceed to the feature presentation, I want to make sure that I do a land acknowledgement, which is an Indigenous protocol used to express gratitude and appreciation to those whose territory you reside on, and a way of honoring the Indigenous people who have been living and working on the land from time immemorial. It is important to understand the long-standing history that has brought you to reside on the land and to seek to understand your place within that history. Land acknowledgements do not exist in a past tense or historical context. Colonialism is a current ongoing process, and we need to build our mindfulness of our present participation. And so since I and likely many others on this webinar are calling in from Takaronto, I would like to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. We recognize that this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work and learn on this land. So I'm just going to stop sharing this poster and introduce our guest presenter. So as you all know, our guest today is Swelen Andari from the Center for Addiction and Mental Health here in Toronto. I'll also take this opportunity to highlight that we have also a guest discussant today, Katie O'Shea, who is a first-year Doctor of Public Health student at the Dalla School of Public Health. But I'll do a formal introduction for Katie after the talk and before she has a moment to share her reflections. So for now, I'll introduce Swelen Andari, who is the Director, Strategy, Climate Resilience, and Youth Mental Health at the Center for Addiction and Mental Health. They are implementing a demonstration initiative aimed at advancing research on climate distress, climate action, and hope for youth. Swelen is also supporting the development of plans to integrate climate adaptation and mitigation solutions within CAMH to advance mental health in the face of climate change. Trained as a creative arts therapist, Swelen has a decade of experience leading the implementation of system-level initiatives aimed at improving access, service design, prevention, and building leadership for youth with lived experience in the child and youth mental health system in Ontario. Swelen's career has focused on moving research into viable action by facilitating processes grounded in implementation science, systems thinking, innovation, decolonial practices, and equitable community engagement. Swelen, thank you very much for joining us today, and I will happily turn the virtual floor and microphone over to you.
Thanks so much, Ashley. I really appreciate it. I'm going just to take a second to share my screen. And you can see it? Yeah, okay, great. All right, hi everyone. It's a real pleasure to be here today with you all. Thank you so much for having me, Ashley. My goal for today's presentation is to speak about the impacts that climate change has on youth mental health, about the opportunities for action across mental health and social services, and how this work can actually catalyze wider systemic and societal changes that we need in this very crucial moment that we're living today. I will also present a short case study on the work that is actually taking place at CAMH, the Center for Addiction and Mental Health, where I work to address the mental health impacts of climate change. So let's get started. I'd like to actually start by sharing a personal story about my own connection to this work and how it led me here. I first got involved in climate action back in 2019 after the IPCC report came out indicating that we only had 12 years until the year 2030 to transition all of our systems to avoid climate catastrophe. And that was the first time I felt the climate crisis was real and present. I felt it in my body because it was no longer this thing that was impacting people I didn't know in some distant future or in faraway places. It was actually happening here and now to all of us, and it will impact the decisions that I had to make today. So I started wondering, what did this mean for me? Could I have children? Was it responsible to have children? What will happen to my family who lives in Venezuela and Lebanon, both countries that are actually more vulnerable to climate impacts? And like, what will happen to all of these places that I love? So this anticipatory grief and anxiety embarked me on a journey where I actually became a climate justice organizer, which is something I had never really done before. This slide here shows all the groups and campaigns that I joined. And admittedly, that climate action actually made me feel less distressed. It made me feel more hopeful and also more connected to people and to the land where I was living. So throughout all this time, I also learned a lot about social movements, about grassroots power, but also about the dreams and the fears of young people across Canada. So that was 2019. Fast forward 4 years, and I was completely burnt out. I spent most of my free time for 2 years of the pandemic in front of Zoom. I was with young organizers across Canada. We were building a climate justice movement organization, and we were really hoping that through it, we could mobilize the power of young workers in the spaces where they navigate so we could win climate solutions that address economic inequality. And at that time, my burnout affected all aspects of my life. So something had to give. And because I couldn't quit my healthcare job, I had to quit my organizing. And so after a year of resting and recovering, a larger truth about this work actually became clearer to me. So after feeling better, I began to research the ways in which climate change was impacting people's mental health as a whole. And I was particularly interested in this, especially after having lived those mental health impacts myself. So let's dive into what I learned. Research is now showing us that climate change is already impacting the mental health and the psychosocial well-being of people all over the world and also right here in Canada. But it won't be affecting everyone the same way. It will actually impact people already facing structural inequities the most. It will exacerbate their social and environmental risk factors while also creating new inequities that we haven't seen before. Some of the groups that will experience disproportionate mental health impacts to climate change are children and youth, but also older adults, people living in poverty and in homelessness, Indigenous peoples, racialized peoples, people living with disabilities, and also those already living with mental health conditions will be very much affected by all of these impacts. And because of all this, the climate crisis has been seen as a threat multiplier. So we cannot really be building health solutions to the impacts of climate change without actually centering climate justice. And also without having an intersectional understanding of how this crisis is and will continue to reinforce the systemic inequities and amplify colonialism, like colonial violence, truly, and racism. So the climate crisis, as you all probably know, is rooted in systemic issues, but so is the mental health crisis. So as I will explore today, the types of solutions that we can actually implement to build climate resilience and well-being in face of climate change are indeed very similar to the types of solutions that will catalyze better mental health and health outcomes for our society and for our youth. So First Nations, Inuit, and Métis youth and communities in this land that we today call Canada are disproportionately experiencing the impacts of climate change. And they're living this, they're feeling this on their livelihood, on their identity, their culture, and their overall health and well-being. So the impacts of mental health are actually intrinsically linked to the impacts on the land. So for young First Nations, Inuit and Métis, this is particularly challenging because climate change can actually disrupt the transmission of intergenerational knowledge and also land skills to younger generations, which is critical to the formation of a strong cultural identity. I think one of the most important ways that I've come to understand the climate crisis is that this is actually a relational crisis, that it stems from a worldview that sees humanity as dominating nature and some groups of people dominating others, which is driving colonialism, exploitation, and extractivism worldwide. And on this land, First Nations, Inuit, and Métis people have been challenging this mindset for centuries, and so have Indigenous peoples all over the world. So to actually create effective health solutions for the climate crisis, we need to be challenging this mindset as well. Indigenous peoples have the strength, the resilience, and the knowledge that we need to help actually build better climate adaptation efforts in our health systems. So it's crucial to involve them in shaping these efforts if we actually want to change the cultural mindset that got us here in the first place. And if we want to ensure that the mental health system stays effective as also all of these needs grow. So young people in particular have a unique positionality in relation to the mental health and also the emotional impacts of climate change. Understanding how young people are affected, but also how they are responding to climate change will actually help us tackle the challenges that the crisis is presenting to their mental health. And what I find particularly powerful about investing our efforts today in promoting young people's mental health, in particular, in face of this crisis, is that this effort in itself can also lead to promoting and protecting the well-being of our societies and our ecosystems, as I mentioned earlier. So let's try to understand a little bit more, what are these mental health impacts on young people's mental health? And climate change may actually affect mental health through various complex pathways. This is not just for young people, but for people in general. And we can understand these pathways as direct, indirect, and overarching. Although I would say that the distinction between all of these pathways is a bit blurry, and so is the evidence that is connected to some of these pathways. It's a bit mixed. So there's still so much that we need to be learning. But as I explained earlier, these impacts actually will be unequally distributed, and young people are particularly vulnerable. So when it comes to the direct impacts of the climate crisis, these actually result from the personal exposure to extreme weather events such as heat waves, wildfires, floods, hurricanes, and so on, but also from the exposure to the chronic climatic changes that we are experiencing, whether it's rising sea levels, of disruptions to our seasonal patterns. And we know that these extreme weather events are now happening a lot more frequently and more intensely because of climate change. And so direct exposure to them may have acute effects on mental health. And on the slide, you can see some examples of what these could be. Now, young people's exposure to these types of risk factors is actually quite significant because we already know that 70% of mental health problems actually begin during childhood or adolescence. So the risk and the protective factors that actually take place during this period of life and how they interact with brain development are key pillars in the development of psychopathology for youth later, like throughout their lives. So ensuring that we're putting our efforts towards preventing climate change from worsening, but also preventing and intervening early when young people are already experiencing the distressing impacts of climate change is absolutely critical for their long-term well-being, for their development, and for their positive mental health. Now, when it comes to the indirect impacts on mental health, these can actually take place through the deteriorating socioeconomic, environmental, and political conditions that are affected by climate change. So, for example, children and youth are unfairly impacted by the disruptions that extreme weather events have on education, which is a social determinant of mental health. Heat can negatively impact cognitive functioning, and that in turn can affect academic performance. And also, some extreme weather events lead kids and young people to not be able to go to school. So, that is one of the potential indirect impacts that the climate crisis could have on young people. But also, on a political level, the inadequate responses that to climate change by governments, by corporations, and other institutions can also result in political apathy and disengagement with electoral politics and overall with climate change governance amongst young people. So there are studies coming out now that are showing that many young people are experiencing feelings of betrayal around government responses to this crisis, which is also impacting their mental health. And it's rooting their sense of hopelessness in not only this kind of disengagement, but also how they conceive of their futures. So what's concerning about all this too is that this type of disengagement in how we're governed will simply reinforce the policies and the decisions that are exacerbating the climate crisis in the first place, which in itself is causing a dangerous feedback loop. But the mental health impacts of climate change don't actually occur to people who are only directly or indirectly exposed to the effects of these climate shifts that we are living. There is also growing recognition that having just knowledge and awareness and the anticipatory or like the anticipation rather of these effects of climate change may also impact mental health. So this abstract knowledge of climate change may be as important for mental health, especially for young people, as observing the local changes in one's environment. So if the systems that children and youth are part of, so for example, the schools that they are going to, are inadequately addressing this issue, either because there's an abundance of negative messaging, or maybe there is misinformation, or in most cases, lack of information about how and why climate change is happening, but also how we can effectively tackle it, then young people may not actually develop adequate knowledge of climate change and how to cope with its implications, which could lead to powerlessness and helplessness. Also, many young people are experiencing, as you can see on this slide, a range of complex emotions in relation to the climate crisis. And people are now referring to these as climate emotions. So these emotions range from despair and grief, but also all the way to optimism and empowerment. And I'd say that I've probably felt them all. And so there's also a lot of new terminology that's emerging to describe some of these experiences. So I will speak to one of these, which is, I'll speak a bit about eco-anxiety, which has become one of the most popularized terms right now. Unlike generalized anxiety, when it actually comes to understanding anxiety about climate change, so what we now know as eco-anxiety, we're actually learning that these are not pathological reactions. They are actually adaptive, they're healthy, and they're powerful responses in people in face of a very dangerous existential and abnormal threat. So that all said, without the appropriate coping mechanisms and the resources that a person might have access to, further distress can actually take place. And that can affect, perhaps in some cases, a young person's daily functioning. It could exacerbate risks for mental health challenges. And so mental health providers need to understand this distinction because we need to ensure that we aren't pathologizing youth and also individuals over healthy adaptive responses that are in fact raising flags that require our collective attention if we are to adapt and mitigate against the dangerous threats that we're facing. But also we do need to understand, mental health providers do need to understand when it is time to intervene more intentionally and in different ways if someone is presenting disruptions to their daily functioning and more distress in their lives. So I want to point to these survey findings on the slide and what they are actually telling us. So how young people are emotionally responding to this crisis, it will impact their well-being. Yes, of course. But it will also affect their mindsets about their future. And how mindsets are shaped will directly impact the kinds of narratives that youth tell about their lives. And these stories will in turn affect the decisions and the actions that they will take today and every day to shape their lives and their futures. So, how well supported are youth in this very moment, not only by the systems that they navigate, including their families and their schools, but also all the spaces that they're part of as they move through these feelings of hopelessness and despair about the future is actually absolutely essential in impacting the kind of future that they will build for themselves and for the world. I also want to say that climate emotions are actually a sign of care. They're a sign of love for people, for other species, for our planet as a whole. And right now, more than ever, we actually need to create ways to support young people and also all people to actually feel these emotions and but also to learn how to cope with them. And part of this too, and part of this journey is also learning how to channel these emotions, which are quite powerful, into positive action. So young people can see themselves as agents of change in building the world that they deeply yearn for. So the rise of hopelessness and despair in young people is something that we also need to be wary of at a societal and at a public health level, especially as extreme weather events become more common and these feelings become compounded by the emergence and the exponential rise of individual, societal, and like community trauma. We will start seeing that all of these effects will actually weaken people's capacity to respond, to engage in the necessary adaptations that that are actually required to make today to protect ourselves, but also to engage in challenging the systems that are at play in perpetuating this crisis in the first place. So at this point, I'm actually going to take a second to pause and invite you to quickly join me in taking a deep breath. I know that I will. Although all of these impacts are very hard to grapple with, there's actually so much that we can do about these issues right now that will make a large difference for our future and a large difference in the lives of those who will come after us. So at this point, then, I'm going to dive in and speak a little bit more about what could be done. And oh, I apologize. There's something wrong with the slide, but it's okay. I will just speak to it. But basically, this list here is a list of protective factors that not only for young people, but for people in general, that can actually protect people's mental health and also their psychosocial well-being. So one of the opportunities that we actually have in front of us for action is that we build initiatives and interventions that intentionally integrate and promote these protective factors. And I will just dive into a few of them. So I will start by speaking about social capital. I don't really love this term, but it does do a good job at explaining basically what it means is that it speaks to the supportive networks and the relationships that we're part of, not only in actuality, but also our perception of our relationships. And so what's actually been really interesting to learn about is that a lot of post-disaster literature and research is showing that this sense of social capital, so the supportive networks, the relationships that people are part of, is actually so important for post-disaster recovery, even more so than other kinds of assistance, including economic assistance. So basically, communities who were connected to one another fared better after disasters, and their mental health was better than those who might have had the economic assistance but did not feel connected. But also, when we talk about building social connection and deepening relationships, we know that that can also enhance mental health. It can address loneliness. It can prevent also many health challenges that stem from isolation. And so I guess I invite you all to start asking yourselves, like, how can our investments and how can our interventions promote social connection? And also interventions that include practices that preserve and restore the natural environment. They are providing people with a sense of stewardship and a sense of personal investment that could help overcome feelings of hopelessness, of anxiety, and eco-paralysis, while also helping out our ecosystems. So projects that connect young people to land-based healing or land-based education can foster deeper relationships and accountabilities, not only to the land, but also to Indigenous solidarity efforts and to truth and reconciliation as a whole. This is also a time when we need to be breaking silos between our fields and to actually foster collaboration across generations and across disciplines, while also being very mindful that we need to be centering young people's voices and their leadership in the design of our efforts, especially when they are meant to be concerning them and their health. So we need to be very strategic in how we design these solutions so we can actually center co-benefits into the kinds of outcomes that we hope to reach. Meaning a single intervention could simultaneously promote positive mental health. It could reduce greenhouse gas emissions or in general promote climate action. Like it could restore an ecosystem, for example, but it could also be designed to reduce inequities and to advance truth and reconciliation efforts. So by actually centering a co-benefits lens, we're not only contributing to building climate resilience among young people and the wider public, but we're also lifting a societal and ecological health because it's one and the same. And this is precisely part of this mindset of disrupting this separation that we as humans and our health it exists from the health of the planet and the ecosystem that we're actually part of. So I really want to encourage health professionals and anyone who is working with young people or who is supporting young people in their lives to actually encourage their capacity to take lead or to join collective actions, initiatives, and to promote their sense of agency. And in many ways, I know that this work is already happening, but it's just a matter of intentionally including a lens of climate resilience and well-being across all of our efforts. Now, I'm going to transition to talk about this case study, about what's actually happening at CAMH, the place where I work for. A couple of years ago, when I healed from my burnout, if you remember from my story at the beginning, and I learned everything that I just shared with you, I actually saw a direct link between what science and what people's lived experience were telling us and the role of the hospital that I work for in responding to these issues. So CAMH is Canada's largest mental health teaching hospital. It's also one of the world's leading research centers in our field. And it significantly contributes to enhancing Ontario's mental health system through a number of system level initiatives. So at CAMH, I was actually very fortunate to have found many allies who also believed in the importance of moving towards climate action today. So I actually built a proposal a couple of years ago for a portfolio with this focus. And today I hold the first role within the hospital that's dedicated to advancing young people's mental health in face of the climate crisis, while also promoting resilience and like climate resilience across the hospital, but also the wider system. A lot has already taken place that demonstrates CAMH's commitment to climate action, and we are actually really hopeful that this is just the beginning of significant and impactful work. And so I'll start actually I'd like to share with you what are the things that we've been up to. And one of the first things I'll share is a little bit more about the project that I'm leading. And this is a project that I'm doing in collaboration with my colleagues from the Youth Wellness Hub's Ontario Provincial Office, which is housed within CAMH, but also at the McCain Center. And we, under the leadership of Dr. Joe Henderson, who has been incredibly supportive, we co-developed a proposal for CIHR, and we received a grant last year to use photo voice, which is a method that uses photography and narratives and meeting making to empower young people and support us in basically adapting Joanna Macy's The Work That Reconnects, which is basically this active hope framework. So it's actually youth friendly, and so it can be designed for it to be more relevant for youth populations in Ontario. The Work That Reconnects is actually an experiential group that's designed to support people to experience their innate connections with each other and also with the larger web of life. But it also supports people to transform their despair and their overwhelm into inspired and collective action to building a life-sustaining society. So currently, this is one of the projects I'm working on. We're hoping that by the end of the year or the beginning of 2026, we will actually have the adaptation of this work finished. And that's just the first phase. The next step will be to get more funding and to test it and hopefully spread it across Youth Wellness Hubs Ontario or any other service that might benefit from groups of this nature. Here is a timeline of, so I'm going to zoom out. And so this is a timeline of the general activities that depict our journey so far at CAMH. In 2019, you would have seen here, it's where it all started. A few staff at CAMH and I formed the climate action team. So we were basically a small group of people. At the time, I was a staff, and we were engaging the union and also leadership to support the global climate strikes that were taking place in September of 2019 that the global youth movement, Fridays for the Future, spearheaded by Greta Thunberg, was quite active and they were leading all over the world. So we begin also to meet not only around this topic, but also we began to meet with our facilities colleagues to advocate for better waste management signage and also for better practices. But the pandemic, we were quite successful at the time, and yet we lost momentum when the pandemic started, and it stalled our efforts as we all went to work from home and we transitioned all of our systems to virtual and life became stressful. But really what we ended up focusing our attention instead, because we kept meeting, was on building leadership buy-in on this issue and really figuring out how might we build more institutional ownership over this so it just grows beyond just a group of concerned staff. In 2021, CAMH released its Truth and Reconciliation Action Plan. And I wanted to point to this because there is such a deep connection between climate change and colonialism. And so we believe that our commitment to truth and reconciliation will actually reinforce our climate justice efforts, but also it goes the other way around. So this is something that we're intentionally trying to integrate into our plans. And between 2021 and 2023, we actually saw a number of CAMH staff on their own taking initiative to integrate climate action into their work in different ways. For example, in 2021, our colleagues who administer the USDA survey, the Ontario Student Drug Use and Health Survey, this is the longest running survey in Canada. It's over we've been running it for over 30 years, and it shows the trends in substance use and health and mental health of students in Ontario. And in 2021, it was the first time that they actually integrated questions about climate change and how it's impacting young people's mental health. And that's really important because now in 2023, they administered it again, and now we're beginning to see trends of how young people are being affected by this in the long term. Also, another example of really incredible work that's happening at CAMH, one of my colleagues, Dr. Sean Kidd, has built a national network and is leading research at the intersection of climate change, mental health, and poverty. And he's informing, national and global policy and research endeavors. and recently released guidelines in face of heat waves for like clinical guidelines on how mental health providers might support um, vulnerable populations in face of an extreme weather event of this nature. And in between 2023 and 2024, Sean and I worked a lot together in leading a few education sessions for members of our hospital leadership, but also for fellow staff. And timing was on our favor because in 2024, CAMH was developing a new strategic plan for the next 5 years. And through our advocacy, but also by giving voice to what many people already cared about, climate action was included in CAMH's strategic plan, which was an incredible win. And it's part of our efforts to, it's part of the hospital's efforts to lift societal health. So this was the first step in truly legitimizing this work at an institutional level, which is giving green light to all of those and all of us who are ready to integrate a climate focus onto our work to actually keep doing it, but also in motivating those who haven't thought about the links between climate and their work to start making those connections. And last year, we formed a climate action steering group composed of members from different CAMH departments. And we hosted 2 retreats that allowed us to guide this effort from a two-wide scene approach, which I'll speak of in a second, where basically we spent dedicated time together to create our guiding principles and the vision and the objectives of our initiative. This is the list of our initial guiding principles. We see them as living, and so I'm sure they will continue to evolve. During our opening retreat, our CAMH elder, Diane Lombard, she opened our first retreat at the CAMH ceremony grounds with a teaching about all-around seeing, or two-eyed seeing approach, which really is about creating an ethical space where Indigenous knowledge is valued alongside scientific evidence, allowing us to actually co-design solutions that support decolonization, that advance truth and reconciliation, but also that address the mental health in face of the climate crisis. So by adopting this approach, we can actually, I really believe that climate is a catalyst for so much, like addressing the issues that we have around climate change. Because in this case, I believe that it's helping us to foster a culture within mental health care that can center all of our relations. And all of these efforts have resulted in the initial design of the Mental Health and Climate Response Initiative. It doesn't really have a catchy name yet, but this is what we're calling it for now. And we are hoping that through this initiative, we will actually bring together multi-sectoral and transdisciplinary partners, as well as the public and people with lived experience, so we can work together to foster innovation, to create new knowledge, but also to inform the evidence base that we have in place and to have a coordinated response to the mental health challenges posed by climate change. We are currently fundraising so we can actually find ways of resourcing, bringing these objectives to life. Basically, what you see here in the blurb, it just says objective number 2. We're hoping to address mental health impacts of climate change on population health as well as for CAMH patients, while also ensuring that all our systems are well adapted in face of emergency events connected to extreme weather events. And before closing off, I really just wanted to take a second to say, for us, what's been really important, but also challenging, is that the way we do this work, our processes, our values, the cultures that we're trying to build through climate action, it matters as much as the actual outcomes that we're seeking. Because at the heart of this work, we really need to shift the way that we're relating to each other and the way that we're relating to the earth. And we're in a moment where collaboration across systems it actually will make a huge difference. It will be a huge protective factor for our well-being. And I believe that climate change can be that catalyst for that collaboration, but also for the deeper changes that we need to make in our society. The bigger truth that became clear to me that I referenced at the beginning of my presentation through my entire journey is that my own well-being was intrinsically, like was and is intrinsically linked to restoring the well-being of the earth and our relations. In a way, I learned that our decisions, even the choice to engage in climate action, actually needs to intentionally steer away from exploitative patterns if we are actually to build a safe and sustainable future. So integrating climate action into my work and into my work life was my own sustainable way of committing to responding to this crisis from a place where I already navigate so I can stay well. And I really believe that this is a time where we all need to be asking ourselves, how might we redirect our attention and our resources and our labor towards addressing the most important crisis of our time? And I actually invite you to keep asking yourselves that question and to find answers that center your well-being and the well-being of your communities and our ecosystem as part of your journey. Thank you so much.
Thank you so much, Swelen, for this very interesting and thought-provoking and emotionally provoking talk. We do have already some questions in the chat, but before we proceed to the Q&A or thought sharing session, I just wanted to introduce our guest discussant, Katie O'Shea. Katie is a settler Canadian, born, raised, and currently living on unceded Mi'kmaq territory in Miramichi, New Brunswick. She has an MPH from the University of Victoria and is currently enrolled in the Doctor of Public Health program at the Dalla School of Public Health. Her professional experience includes community health nursing in British Columbia, inpatient psychiatry for youth and adults in New Brunswick, and since 2017, leading a service coordination and clinical team with the North Shore Mi'kmaq Tribal Council in New Brunswick. And in this current role, she manages community-based services for children and their families in 7 Mi'kmaq nations, funded through Jordan's Principle, a rights-based initiative designed to ensure equity and health, social, and educational outcomes for First Nation children, as mandated by the Canadian Human Rights Tribunal rulings. Katie, thank you so much for joining us, and please feel free to share your thoughts when you're ready.
Good morning, everybody. Thank you, Ashley, for the introduction. And Swelen, that was an incredible presentation, very thought-provoking, and personally is impactful to me as well in my personal life. So I'm a settler Canadian. I work with the Tribal Council here in New Brunswick. I'm coming to you from unceded Mi'kmaq territory here in Natawaneg First Nation. So I'm a learner in this topic as well. When I was approached to provide my input in this space, I said, I don't know much about it. So I just want to offer some of my reflections on my clinical team and how we've taken cultural competency and adapted some of our practices to incorporate the natural world and support our children and our youth better. And in general, you know, when I was thinking about the First Nation Indigenous context of this, we do land acknowledgements. You know, we start every meeting with a land acknowledgement and the priority of that connection with nature and of land. And traditional knowledge is land informed, and ways of being and knowing are connected with the land. And one of the determinants of Indigenous health is environmental stewardship, land stewardship, protection of our water and ecosystems, and just those reciprocal relationships. So very interconnected with cultural perspectives of climate change and land stewardship, et cetera. So with our clinicians, obviously, we do as best as we can to incorporate cultural practices and make sure that everyone is culturally competent, et cetera. All of our clinicians presently are settlers. We're working on it. We have various, you know, youth engagement processes, and we're trying to get our youth to go into our allied health professions. But right now, everyone is settlers. So when we do our training and we make our policies and practices and consult our knowledge keepers and our elders, how are we making sure that we incorporate cultural knowledge into the way that we deliver our services? So a big thing that we've enhanced in our practice is incorporating our clinical practice with connection to nature and our outcomes with nature. So during the pandemic, obviously our occupational therapists couldn't see clients in the way that they used to be able to see them in their homes, in the offices. So they started walking with them. It would become a walking session was the way that they were incorporating their their functional outcomes and their functional goals. And from that, we can teach our clinicians, we can try to teach cultural competency, but it was from those adaptations within the pandemic where they realized how much being outside affected our kiddos, and how being able to point out an animal or a bird or just those connections with the natural world really enhanced what they were able to provide, and the response that our kiddos had within those walks in nature. Our speech therapists, I was just talking to one the other day, and she said, there's different PECs, the picture communication systems, and the different vocabulary that they're using to promote the speech language stuff. They're using words like robins and birds, and rather than like a fire truck, or they're utilizing pictures from nature, and they find that the kids and the children and they respond so well to just the connections with the land, and how we've incorporated that into our practice. And in general, I think as clinical staff, imagine if our mental health clinicians and our psychologists, imagine if they knew more about the effects of climate change and environmental stress, how our kiddos are internalizing that, how that affects their life. Imagine if our clinicians knew more about it and then were able to adapt their practice to be able to support our kids in that way, in a better way, in a way that speaks to cultural values and speaks to a overall wellness that is in relation to the land. So that's our clinical experience. And just my last statement is that we recently did youth engagements we're trying to enhance the allied health support network that we have available to our kiddos. And we did community engagements. So we went out and we asked what enhanced services do the communities need? What do our kids need? And I said to one elder, I said, can you tell me about what our kids need? And he said, you're talking to the wrong person. Don't ask an adult, don't ask an elder, don't ask old people about what our kids need. You ask our kids. You want to know what kids need you want to do you want to figure out what kids need for enhanced programming, do youth engagements, get the kids at the table, ask the kids what they need. So as we try to support our children and our youth better in our ground level practices, just making sure, and Swelen, you said, making sure we center our youth voices in these solutions. How can we make sure that our kids are telling us what they need and not us saying, this is what you need? Thank you.
Thank you so much, Katie, for those thoughts. I will turn to the chat first. We have a few questions. If you have a question, also feel free to raise your virtual hand if you want to ask it orally. Hopefully we'll get through them all. So the first question, Swelen, was just around the evidence that you're presenting and whether the impact being studied in youth is around the world or only in first world countries.
Yeah, and I saw that someone replied, but yes, the evidence that I showed on the slide was Canadian based. However, there are many studies that are being done at a global level in countries that are not like basically countries from the global south. So yes, it is impacting young people around the world in similar ways.
Thank you. And there was a question about one of the infographics you showed. I think it was the one that was showing the different sort of terms that could be used for types of sort of like mental stress, and whether that came from the Hickman study, which I'm not familiar with. I don't know if you are.
I'm not familiar with the Hickman study. This infographic, it's not, I mean, I see in the chat there was a question about whether it can be, we're not able to use it widely because of the context of this being like a seminar and my colleagues had brought it to my attention. I thought of sharing it because they did a really good job at explaining some of the diverse experiences, but I wouldn't necessarily use this without, like, wider without further permission. Yeah.
Thank you. Another question about whether you connect with the Children's Environmental Health Center at the University of Alberta.
No, I'm not connected to them.
Okay. There are a couple of examples shared by David Berman, the Water is Love film, which I think was an example that sort of was in parallel to something that you were speaking to, as well as the 7 Generation Legacy Project. So some resources for others to check out. Another question, whether children or youth are being involved in the development of the programs and work at CAMH, and if so, how?
Yeah, that's such a good question. So through the project that I'm leading, we are directly working. We have 10 youth advisors that are part of our team, along with 2 youth engagement specialists who are young people that are also like hired by CAMH. And we're working together as study team members to basically, we're co-designing the research to adapt to the work that reconnects. And we are we're basically going to analyze the data together. So we are partnering in this process of adaptation, and that is that is the work that I'm currently doing. Now, when it comes to the larger initiative that we are working towards, we have been partnering with those young people who are part of the McCain Center for Child and Youth and Family Mental Health. So basically, we have been engaging those staff in order to ensure that once we are ready to move a little, as I mentioned, we are still working on trying to get funding. So a lot of our efforts are led by myself and with a bunch of colleagues who basically do this work on the side of their desk. But once we're able to actually have more, we will be able to engage young people more formally, because we also believe in retributing, like, we need to be incentivizing young people and providing them honoraria for their time, and because it's a valuable time as they continue to be engaged in any project that we do. So we hope to bring them on when we're able to actually resource it. But other than my project, we're not working directly with young people yet around climate mental health initiatives.
Thank you. And sorry, that question was from Shatadi. And this one is from Lana. I didn't hear much about climate-induced migration and how that impacts mental health in youth, and wondered if there are elements of active hope that could potentially be adapted to those contexts, or if you know of any toolkits or other strategy guides for promoting youth mental health in situations of climate-induced migration.
Yeah, that's such a good question, and it's such a large topic. I'm aware I didn't touch on it. I don't, a lot of people are working on adapting the work that reconnects for many contexts, including there have been some people that for the last few years have been working intentionally to make it more mindful of like anti-racist and anti-oppressive approaches. Because the work that reconnects was actually designed in 1970. So it's grown and changed a lot throughout the years, but it has been implemented and adapted by many people all over the world. I am not necessarily aware of any adaptations currently taking place around migration and how it impacts young people's mental health. I do believe that it has the potential of being powerful for young people living through those circumstances. But I wouldn't be able to point you. This is like an area that I still have to learn more about. So I wouldn't be able to point you to other resources. I'm sorry.
Thank you. There are several words of appreciation and sort of, relation in terms of your talk. So thank you so much. And I just want to make sure I capture all the questions. And I'll just note also that Robert shared the link for the Hickman study. So this is climate anxiety in children and young people and their beliefs about government responses to climate change, a global survey. That was what he's referring to.
Yes. Now I know which one you're referring to. So to then answer the other question, no, the infographic is not linked to that study. Yeah.
Trish has a question. There's now compelling evidence that getting involved in climate change has beneficial mental health effects for those with eco-anxiety and climate-related PTSD. But what about subsequent burnout? Is there literature on how common that is, and is the treatment any different from burnout from other causes?
That is such a good question, and it's precisely the nuance that I believe many of the people working at the intersection of climate and mental health are trying to do their best in educating people around. So Carolyn Hickman actually speaks about this as, internal activism versus external activism, and how as we are supporting people to engage in activism and advocacy in any kind of effort that it's outward, we actually need to first be supporting them, especially young people who might have never really done something of this nature before, to also build the resources to protect themselves and to support their own well-being as a priority. Because burnout is actually, I wouldn't say it's inevitable, but it's likely, it's probable. And so is the treatment any different? Well, I would say that I wouldn't know whether how people are supporting those moving through burnout when it comes to climate action are using similar strategies as like burnout from other types of engagements or life circumstances. I wouldn't be able to tell you. But I do believe that people that are actively researching and designing interventions are keeping that in mind, hence why the value of mental health when we talk about action.
Great, thank you. And I'm just going to turn